Patient that was just diagnosed with Guillain-Barré syndrome. She is a 36-year-old female African American. She is single currently, so she's not married or anything. Her chief complaint coming in was muscle weakness. All her labs were normal, except for she did have a low hemoglobin. So what we're assuming right now that it could be possibility from the Guillain-Barré syndrome affecting her to where it's messing with her respiratory system. She had complaints of muscle weakness while she was exercising at home. She lives at home alone, so she had to get herself to the hospital. So right now we're going to go ahead and proceed in and talk to her and let her know exactly what the syndrome is that she has and how we can go about planning to go ahead and get her on the path to correcting it and to where she can return to her normal life.
Hi, how are you?
So they told me that you was just diagnosed with Guillain-Barré syndrome.
Mm-hmm.
Okay, so first off, do you know anything about that?
I don't. I just want to know what is that actually?
Well, what Guillain-Barré syndrome starts out with, it starts out from the bottom. From what I read in your charts, you have ascending Guillain-Barré syndrome compared to descending Guillain-Barré syndrome. And ascending Guillain-Barré syndrome actually starts at your feet and progresses up towards your upper body and then upper torso. While descending Guillain-Barré syndrome will start at your head and then progress downwards. And that one deals with your respiratory system, so it messes with that. But also with ascending, the one that you have, it'll start from your feet and progress upward. So did you notice any signs of muscle weakness that you was having?
I've been experiencing some burning and like tingling in my legs. Mm-hmm. So I went to the doctor to get checked for that.
Mm-hmm. Okay, well, whenever you was walking, did you experience any kind of weakness that you was having where you may not be able to, complete your full day of activities like you normally have?
Somewhat. When I was working out, I noticed that I was getting tired a lot and my legs were kind of achy.
Okay. Well, one way to explain that is what it does is it starts off with muscle weakness and then it'll progress to paralysis in a sense. So you will end up being paraplegic from the waist down to where you won't be able to use your lower extremities, and then it progresses upward. So there are ways to treat it. Well, one, you can also have plasmapheresis. If you're willing to, we will recommend that you do have plasmapheresis. And what it is we'll actually connect you up to a machine that will actually like almost filter your blood, and they'll replace like your immunoglobulin with other immunoglobulin or albumin, depending on which one you would specify that you're okay with.
Okay. I have a question. I was jotted down some questions. Will it affect my asthma, you think, by any chance?
Well, with ascending, with ascending Guillain-Barré syndrome, like I told you, it'll progress upwards. So it is it's a strong possibility that it can affect your respiratory system because as you see, it's already affecting your muscles in your legs. So your diaphragm that helps you breathe is also a muscle. So it can also impact that muscle also. So what I'd like for you to do is to continue monitoring and taking your asthma medication.
Okay.
Do like you normally have. Okay. And if you experience any shortness of breath, struggling to breathe, like extreme muscle fatigue, restlessness, anything, I'd like for you to go ahead and call back here so we can figure out and take precautions for that.
Okay. Is this a certain amount of time, or how long will this last, or will it be forever?
No, actually, Guillain-Barré syndrome, it will go away. So it's not one that will be chronic or anything like that. So with it, you're looking, most time, the general time frame is from 6 months to 24 months for it to go away. So it depends really on your body because what it does is it affects your it affects with your nervous system with your myelin sheaths over your nerves, and the myelin sheaths actually helps transmit the neural pathways to where the brain can communicate with the muscles or whatever that it needs to. So what it does is it affects that, and it's also like an autoimmune disorder.
Okay.
So it could have been triggered from vaccination that you may have had, or also a viral infection that you may occurred recently.
Okay. Am I going to be able to be alone in my house, or do I need to have help, or?
With that, sorry to cut you off, but with that, I'll also like for you to bring your family in, also another visit so that we can take precautions because like I said, you will end up, muscle weakness will lead to paralysis, and with this disease of Guillain-Barré. And so I like for you to bring your family in so I can go ahead and tell them how they can go ahead and prepare your house. You know, get rid of throw rugs that may be on the floor, or to where they can go ahead and prepare to where somebody will stay with you, somebody come take turns to stay, and to where you know it'll basically be usually friendly to you so that you're not put at a disadvantage, and also possibly get home health care to come nurse so they can provide you with your medicines, or also take you to the hospital so you can get your plasmapheresis.
Okay. I guess I can reschedule an appointment to come back with my family to discuss that. So I won't be able to work anymore.
I wouldn't advise that you work. As you know, it is your personal decision, but I would strongly advise that you do not work, because with the state that you are, it doesn't. You may not know exactly how quick it may keep affecting your other body and your muscles to where if you go to work, it may progress it because of strenuous activities. It may further the disease along.
Right.
So I would advise for you not to go to work and go ahead and let this disease make its course and get through to where once you finish it and once it goes away, you can proceed back and going to work.
Okay. Thank you very much.
No problem. Did you have any other questions or anything?
No, sir, I don't.
All right. Well, it was nice to see you, Miss
You
Simpson.
too. Thank you.
Be sure to bring your family back so we can take care of them.
Hi.
Again. Was you able to get in contact with your family?
Yes, I have.
Okay. Was y'all able to decide on a date when you would like to reschedule?
Yes, sir. I think we're gonna reschedule to after the holiday, and we can come in and do a more formal sit down.
Okay. Well, what I had did was I had went and bring you some extra information about Guillain-Barré syndrome itself, to where you can kind of understand what it is, and then you can show your family also so that they can see what Guillain-Barré syndrome is and actually read up on it, so that when they come in, they can ask their questions that they have that they may not be able to answer fully. Like what we was talking about earlier with the difference between ascending Guillain-Barré and descending Guillain-Barré. This brochure will actually go over it. So as you can see right here, it's talking about ascending Guillain-Barré and the difference between descending Guillain-Barré. And then, as you remember, we was talking about how it progressed from your feet upwards to where you had muscle weakness and you was feeling, you may end up short of breath. This right here will explain the symptoms that you would have. And then right here, as you can see, we have our interventions that we can take to where we can go ahead and help this syndrome progress on to where, but we'll still have to let it run its course. So, as I told you before, it takes 6 months to 24 months generally. So it all depends on your body and your immune system and nervous system recovery to how long it'll take. And then also go about talking about the plasmapheresis that we can go through, and actually give you a little bit more in-depth detail about what plasmapheresis is so that you can kind of understand. And also right here, you can see it'll actually give you tips on how to actually go about your actual day of life dealing with Guillain-Barré syndrome, and actually how you can incorporate your normal lifestyle into it, but also incorporate Guillain-Barré to where it's actually working with you and to not where it's working against you. And right here, it also talks about some of the meds that you would be on. So just in case you may experience some pain or anything, we'll be giving you'll be prescribed one of these medications, and we'll actually go over it to where once you come back, we'll go over the medications with you once we decide which ones you're going to get, depending on your blood work and your other labs that we took from you today. Because you remember when we had done the lumbar puncture on you earlier, we had got some of your cerebrospinal fluid. So once the tests come back from that and everything, we'll be able to decide what medication we feel is best for you to actually be on, where it can help you with everything that you need.
Okay.
And that's your brochure to keep. And also, if you have any questions, feel free to call me at the office and just let me know anything. And if your family has questions, they can either hold them until when we come back for our rescheduled visit, or they can call now or whenever it's convenient for them.
Okay. Thank you.
No problem.